Module objective, to equip you with the comprehensive knowledge, skills, and critical adaptations required to safely and effectively provide basic life support BLS to infants and children. This includes identifying pediatric emergencies, modifying CPR techniques, utilizing pediatric AED protocols, and addressing ethical and legal considerations surrounding resuscitation of minors. Module content. Overview of Pediatric Basic Life Support PBLS. Children and infants are not small adults. Their anatomy, physiology, and causes of arrest differ significantly, necessitating specialized protocols for basic life support. Key differences: higher respiratory rates, smaller airway diameter, making them prone to obstructions. Cardiac arrest is often secondary to respiratory failure or shock, not primary cardiac issues. The goal of PBLS is to ensure oxygenation, maintain circulation, prevent progression to irreversible organ damage or death. Age-based categories in PBLS. Age group, classification 0 to 28 days, neonate 1 month to 12 months, infant 1 to 12 years, child 12 plus years, adult protocol applies. Assessment and initial actions. Check responsiveness. Tap feet or shoulder and shout. Look for alertness, crying, or movement. Call for help. If alone with a child or infant, provide 2 minutes of CPR first, then call emergency services. If 2 responders, one calls EMS, the other starts CPR. Open airway infants. Neutral head position. Children. Slight head tilt chin lift. Check breathing and pulse breathing. Look, listen, and feel. Pulse. Infant. Brachial artery. Child. Carotid or femoral. Pediatric CPR techniques. Chest compressions, metric, infant, child, 1 to 12 years. Compression method. 2 fingers, 1 rescuer, or thumbs, 2 rescuers. 1 or 2 hands, depending on size. Compression depth approximately 4 centimeters or 1.5 inches, approximately 5 centimeters or 2 inches. Compression rate 100 to 120 per minute, 100 to 120 per minute. Compression to breath 30 to 2. 1 rescuer, 15 to 2. 2 rescuers. Same rescue breathing infants. Seal mouth and nose with your mouth. Children. Pinch nose. Seal mouth. Use gentle breaths, just enough to make the chest rise. AED use in pediatrics. Use pediatric pads if available. Reduce energy dose to 50 to 75 joules. If pediatric pads are unavailable, adult pads can be used, 1 on chest, 1 on back. Follow voice prompts strictly. Pediatric AED protocols apply to children under 8 years or less than 25 kilograms. Special considerations: airway obstructions. Common in infants due to small airways, back blows and chest thrusts, infants. Abdominal thrusts, children greater than 1 year. Drowning. Initial focus should be on rescue breathing and oxygenation. Sudden infant death syndrome, SIDS, immediate CPR and EMS activation. Emotional support for families, post-resuscitation trauma. Maintain spinal precautions while performing. CPR airway assessment must not cause further injury. Emotional and ethical dimensions in pediatric resuscitation. Emotional toll. Pediatric emergencies can deeply affect responders and family communication. Provide clear, compassionate updates to guardians. Consent. Implied consent applies in life-threatening pediatric emergencies, end-of-life issues. Respect advance directives, where available, but initiate resuscitation unless clear DNR exists. Cultural and legal aspects. Parental refusal of care. Emergency care must still be provided if child is at immediate risk. Legal protections. Rescuers are protected under Good Samaritan laws. Cultural sensitivities. Gender, touch, and religious beliefs should be considered when possible learning outcomes. By the end of this module, you will differentiate pediatric BLS protocols from adult protocols, demonstrate CPR techniques for infants and children, apply correct AED use for pediatric emergencies, manage emotional, ethical, and legal challenges during pediatric resuscitation, integrate cultural sensitivity and trauma-informed care in pediatric emergencies, accreditation compliance. This module aligns with recognized certification and regulatory bodies: European Resuscitation Council, ERC, Pediatric Guidelines, American Heart Association, AHA, Pediatric Advanced Life Support, PALS, Framework, UK Resuscitation Council, Pediatric BLS Standards, ILO/WHO Health Worker Training Guidelines, complies with ISO 21001 and ISO 29993 for learning services.